firstly I'm going to try and remove any objects that are in the way that could be potentially dangerous. He looks like he's in shock, so I'm going to check for any disabilities in his head or spine. I'm going to loosen his airway, check his airways. I'm going to check his pulse. Okay, I'm going to check for any more potential hazards. It's pretty cold in here, so I'll give him a jacket. Okay, so place his head to try and get his blood flow back into his head. Can you call 999 for me? Yeah. You'll be alright, man. Ambulance is coming. You'll be okay.
Okay, so can you tell me what you did right at the start of your treatment?
So at the start, I was checking his pulse, checking if there's anything blocking his airways that could restrict air coming into his lungs and his body.
Okay, and what would you call that?
A primary survey.
Okay, why did you do a primary survey, not a secondary survey?
Because it was potentially life-threatening. Because I wouldn't know if he was having a heart attack or any other potential dangerous medical condition. So I was checking if he was still in shock, which he was, because he was showing clammy skin, his skin was cold, there was paleness in his face, and yeah.
Okay, good. So I noticed that you did various things to treat the patient, one of which was raise his feet. Why did you do that?
So the blood flow will, from his legs, go straight back into his head, so it'll get more blood flow into his head.
Okay, and then towards the end of the treatment, you were checking his pulse and his breathing regularly. What would happen, or what would you do if he stopped breathing?
I'll assess it, and I'll treat it as potentially life-threatening as well, and I'll perform CPR if it's needed, and wait until the ambulance comes.
Okay, thank you.